So for those of you who listen to the show on a regular basis, you might already know that. For those of you that don't, I'll share it with you now. I am 26. In fact, I just turned 26 on January 31st. And because of Obamacare, I actually was able to stay under my mother's health insurance until I was 26. Now, it's an overwhelmingly positive thing, and it really shows you how Democrats are just much better than Republicans, right? And Democrats are corrupt too. They don't fight nearly as hard. They're really disappointing. You guys know my spiel on that. But they certainly are better. There's no doubt about that. Because if it was, a Republican president, I would have been kicked off my mother's policy at age 21? Or is it 23? Or whenever you're out of college. Something like that. In roughly in that time span. As part of Obamacare, they extended it to 26. So when I graduated college, I went and worked in the car business briefly. I was a car salesman for about a year and a half maybe. At most 2 years. Sorry how my memory is foggy on this. But roughly, thereabouts. And so when I was there, I had insurance through them. And then when I was not working there, when I left there, I was able to go right back on my mother's policy, which is fantastic because as starting up, SecularTalk, which you guys are listening to now, it's basically running a small business. And of course, small business owners, they're in a kind of a predicament, especially if they don't make a lot of money, like I wasn't, and still really am not, but it's one of those things where are we going to get our insurance? So I was able to stay under my mother's until I was 26, so I was just hit the point where I can't stay on my mother's anymore. So this weekend I had to sign up for Obamacare. So being that I follow these things obviously on a daily basis, it's what I do, that I need to learn about all the ins and outs and the nuances of the law. I had, I would say, a slight advantage over your average person who would just go in and just say, I don't know, how do I sign up? How the fuck does this work? So I went through the normal process. I went to healthcare.gov. Of course, healthcare.gov, as it is supposed to, redirects you to your state exchange website. Now, unfortunately for 25 states, they're already fucked, because there are 25 Republican states that just didn't set up their state exchanges, so Obamacare needed to rewire their website and rework their website so that they could have, options there for the people in the states that didn't set up their exchanges. So since I live in New York, I'm lucky that my state is a smart, progressive, intellectual state, so they set up their exchanges. And the process was actually pretty easy, I must say. So you just got to I had to put in my name, my employment history, my social security number, all the basic information that you would have to put in if you were just going straight to a health insurance company. And then it gives you, after you put in all your information, it gives you the amount of a subsidy that you get, which I thought was cool. You type in all your information, it's like, boom, okay, so you're entitled to, I think I got it was $130 a month. That's the subsidy I was entitled to with my income bracket. Now, I didn't make little enough to qualify for Medicaid. I did make enough to get into the exchanges, and I get the subsidy of $130 a month. So then I'm shopping through the plans, right, and I'm reading through my options. And there's, of course, just like they set it up, the bronze plan, the silver plan, the gold plan, and all different, health insurance companies give you the different options, and they'll go through the information as to what's provided in the plan. And I ended up settling on a silver plan. It's going to cost me $255 a month after you factor in the subsidy. So in reality, it's $130 more than that. And so I signed up for it. Now, here's the thing. This is where it gets really interesting. It became apparent to me that everything that the government did, every process that was set up by the government, the state government of New York, was good. Like, it was easy to use, it was simple, it was 1, 2, 3, boom, you're done. But everything that was affiliated with the health insurance company, it was a clusterfuck. It was all fucked up. So, for example, I needed to try to figure out if my doctor was part of the plan that I was trying to join. And the government is not allowed to put that information there. The health insurance company is supposed to provide that information, and none of them did. They would just say, yeah, here's the plan, yada, yada, here's the information, and go ahead, pick what you want. So, okay, but does this have my doctor available in it? Nothing. Crickets. It didn't say. It doesn't say, oh, this hospital's included, this hospital's included. Now, at the same time that's happening, it tells you none of the plans, not even the gold plans, allowed you to go out of network. So if you get a health insurance policy, let's say something bad happens to me, I have a heart issue, a heart attack or whatever, and I got to go to the nearby hospital by me. If that hospital is not part of my network, then they just charge me full price. The health insurance company won't pay for shit. It's ridiculous if you really think about it. And so here's my final conclusion. So I signed up, everything's taken care of. But here's my final conclusion. Yes, Obamacare and the state exchanges are much better than if that system didn't exist, right? And you can see that just by virtue of the subsidies, right? I saw the price like, a gold plan, $600 a month, $800 a month. Silver plan, $600, $500, roughly that range. A bronze plan would have been like $300. And then when you see with the subsidy, so the government doing their part, and then boom, okay, so it knocks it down a little bit. So Obamacare is better than doing nothing, that's for sure. But the system as it exists right now is still ridiculous, right? And what we should have, it's so obvious, is a Medicare for all system. How much easier would it be, not just for me, I know this is anecdotal and your experience might be different, but how much easier would it be for all of us if, when you get your paycheck every week, every month, or however often you get it, there's a line that says healthcare, and it takes out whatever, 2% of your income, 3% of your income. Boom, you call it a day whenever you go to the doctor. You don't have to pay anything out of pocket. There's no copays. It's just taken care of via your tax dollars. Like every other modern industrial nation, that's how they do it. But we don't do that here. And this is the part, I saved the part that pissed me off the most for the end here, okay? As part of it, every single plan that I had an option from, whether it's bronze, silver, or gold, they would have a deductible, right? The least expensive deductible I saw, $2,000. So you know what that means, right? No matter what happens, if I go to the emergency room, if I go to the doctor or whatever, I have to pay out of pocket $2,000 before they pay for anything, before any insurance actually kicks in. So let me get this straight. I pay you $255 a month, and then when something goes wrong, you tell me, oh yeah, I got it, it's cool, but you have to pay the first $2,000. Then why the fuck am I paying you $255 a month if when anything happens, I got to cover the first $2,000? That's ridiculous. And that was the best deductible I saw. Everything else was $3,000 or $6,000. I was like, what is this? This is a giant, tremendous scam that they're running on the American people. Even for a fucking checkup, man. Even for a checkup. It says, yes, it's subject to deductible. So the copay might be $30, right? But until I get over $2,000, I have to pay for a full checkup out of pocket. So it might be $300 I have to pay. Man, I'm telling you, man, the Republicans always scream about less government, less government, less government. In this case, we clearly need more government. Whether it's the government stepping in and saying, we're capping the amount that you can charge for a copay. We're capping it at $200. Or something reasonable where it makes sense, where people don't go broke when they pay for medical bills. By the way, that's the number one cause of bankruptcy in the U.S. But we need more government, whether it's limiting the copays, limiting the deductibles, setting harder price caps, setting a hard profit margin by law, or just doing a Medicare for all system. The answer is definitely bigger government.